Hi, Dr. Peter Coleman, retired addiction medicine specialist. And today we're going to talk about the fourth part of the brain that gets damaged by the drugs and by the addiction process, and that's the prefrontal cortex, the thinking part of the brain. And it's amazing to me just how distorted people's thinking is when they're caught up in the disease of addiction. It's often a slippery slope. It starts off pretty easily. I know for me, my thinking started getting more and more distorted as time went on. Initially, when I started smoking pot, I knew it was against the law, but I told myself, well, that's not so bad. Everybody's doing it. And then started drinking heavily and doing other things like that. And then eventually using cocaine, injecting cocaine, and telling myself, well, that's sort of normal. A lot of people do that, even though I knew John Belushi had just died from it. Then I always told myself I would be a good doctor, that, I would never hurt patients, that I would never do anything like that. But I broke that rule by, having a drink at lunchtime one time. Well, it's just one drink, I told myself. Nobody's going to even be affected by that. And then it was like, well, I was on call and maybe a couple of drinks with dinner or after dinner, and 3 or 4. Well, not many people call after hours, so, that's not going to hurt anybody. It just got worse and worse. By the end, I was injecting cocaine at work in between patients. I'm just mortified to think how horrible that was. But even at that time, my thinking was so distorted. I thought it was just a fun experiment that I was doing, that I was such a smart scientist that I should find out, if I could do this. And it's crazy. I see that all the time in the patients that I treated. The denial takes many forms. The first one is denial. So when I was in rehab, this young kid, 22-year-old, after like 3 weeks, he said, I'm done, I'm ready to go home. Everybody's like, what are you talking about? You haven't learned much at all. And what's at home for you is your girlfriend who's still using heroin. You don't have a job. You don't have any money. He's like, I'm fine. He couldn't see that the risk that he was taking was just ridiculous. There's no way that he was going to stay clean and sober. But he couldn't see that. His thinking was so distorted. Impulse control gets damaged by the drugs, as we've talked about in other videos. And so that makes it really hard to resist urges. And when we get that strong dopamine spike from the drugs, we want more and more, and we have less and less ability to resist the impulse. Delayed gratification gets worse as the disease goes on. There are studies that look at people, and they do experiments, like they say to people, okay, we'll give you $10 now, but if you wait till tomorrow, we'll give you $100. Normal people say, of course I'll wait a day to get $100 instead of 10. But people with addiction are just unbelievable they can't delay their gratification. They'll take the $10 now. They've learned they don't trust the world, that, things might not happen, and they want it now. Drugs, I want it when I want it, and I want it now. That's what they're all about. Social norms get damaged, and that changes how we think about the world. We start hanging around with other people who have morals and values and ideas and activities that they're doing, and we start becoming affected by that, so our thinking gets distorted that way. One of the saddest things is that our thinking gets distorted in terms of hope. We start losing hope. People often get suicidal. They think, what's the point? I might as well just keep using, even if I die of an overdose. Who's going to care? Nobody's going to care. It's not going to matter. It's really sad. They can't see that there's another whole world out there that is available to them, and all they've got to do is give up getting high, get some help, and start making better decisions. Why do drugs do this? Well, the drugs are calling to us, and it's just a dopamine thing, and sometimes that's, some post-acute withdrawal that the brain hasn't healed yet, and so our thinking is distorted. The addiction pathways get stronger and stronger, so that the more we do things, the more we get those pathways get entrenched in our brain, and so that makes our thinking stay distorted. Change is scary, so a lot of people, even who don't have addiction, are afraid to leave a bad relationship or get out of a job that they don't like, because it's just scary going into the unknown. The companions that we keep make a big difference in terms of how our thinking stays distorted. And a lot of times we had somewhat distorted thinking before we even started, because we often grew up in traumatic environments, and so we had low self-esteem, and we didn't have good skills at learning how to deal with emotions and dealing with reality, and learning how to calm ourselves down and how to deal with things. So our thinking was not great even to start with. It takes time for the brain to heal, but the brain will heal. But it does take time, and we see people for quite a while afterwards, after they stop using the drugs, still have distorted thinking. And my example of that is when I was about 2.5 months into my recovery. I hadn't used drugs for 2.5 months. I was living in a halfway house, and this guy came into the hospital where I was doing some work, and he said, oh, he threw out half a bag of cocaine on the freeway on I-64 as he was coming into the hospital. So the guy was in the halfway house, and I went out one afternoon looking for that bag of cocaine. There we were on the side of I-64 looking for a bag of cocaine, 2.5 months clean. That was our best thinking at the time. We told ourselves we weren't going to use it, of course. We were just going to sell it and make a little bit of money. But that was our best decision making even 10 weeks later. So it takes time to heal. And how do we help it to heal? Well, we stop using drugs and alcohol, of course. We get into therapy so that a therapist can help educate us about what different ways of doing things, different ways of looking at the world, different ways of calming ourselves down, and learning how to deal with our emotions. Support groups are incredibly helpful, because when you hang out with, the winners, when you hang out with people who have learned how to stay clean and sober, you start learning their social norms and their ways of doing things, and you can run ideas by people, and you can get new ideas and new ways of doing things. Following advice, especially in the early days of recovery, is so important. When I got out of my rehab after 4 months, I didn't quite know where to live. My license was gone, and so I had to wait to try to apply for my medical license again. And I thought about going back to Richmond or living in Hampton, Virginia, which is where I was in rehab. And my advisors said, don't go back to Richmond. The only people you know there use drugs and alcohol. Here, you know hundreds of people now, after 4 months, who are clean and sober. You've got therapy here, you've got all these things. And so I followed their advice. And I learned that I'm better off to listen to other people, especially in the early days, and get advice. And then so I stayed in Hampton, and I had a great time. I got a little apartment by the beach, and I bought a windsurfer, and I started windsurfing every day, and I went to the gym, and I hung out with friends, and I eventually got a part-time job working in emergency room. And so life was good.